Thanks, Ryan. Good afternoon, everybody, and welcome to today's webinar, our next session of the Nurture Me monthly webinar series. Today we have the Bundle Project, Empowering Parents and Supporting Children in Maine, featuring Matt Donahue. My name is Hannah Winkelhopper, and I am the ACE and SEI Prevention Coordinator at the Maine CDC. So before we introduce Matt, a little housekeeping. Today we're using Zoom's webinar format, which focuses on the presenter. However, you are encouraged to share questions with Matt to answer in the Q&A section, which I will be monitoring throughout the webinar. If you have any technical questions or would like to add to the conversation, please direct your comments into the general chat section. Near the conclusion of the webinar, Ryan Nealon from AdCare will share an evaluation link for today's presentation. We appreciate you taking a moment to provide your valued feedback, which helps ensure that we are providing quality content. Also, Ryan will be sure to email your participation certificates within 10 business days. And now it is my pleasure to introduce our presenter. Matt Donahue serves as the Vice President and Chief Impact Officer at Heart of Maine United Way, where he leads and innovates the organization's community impact initiatives. He holds a BA in Public Management and a Master of Public Administration from the University of Maine and is a graduate of the Bangor Region Leadership Institute. Matt has led the planning and implementation of the Bundle Initiative, facilitating all aspects of the work, including funder relations, stakeholder engagement, and vendor management. His commitment to positive youth development is reflected in both his professional work and volunteer service. With more than 2 decades of active volunteerism, Matt currently serves as board president of Bangor Little League, sits on the University of Maine Board of Visitors, and is the Penquist District Liaison for the State Public Health District Coordinating Council. Matt and his husband, Derek, were previously licensed foster parents in Maine. They live in Bangor with their 2 sons, Christopher and Owen. Welcome, Matt.
Thank you, Hannah, and thanks for having me today. I'm really excited to be able to talk to you about the Bundle Project. As the housekeeping items that Hannah mentioned, certainly feel free to use the chat as we go, or the Q&A, I should say, as we go, to be able to foster good conversation, is making sure you really understand what we're trying to accomplish, and if there are nuances or pieces that I can help answer or take offline after the fact, I'm happy to do so. One of the things I wanted to just start off with is, I know my bio, I hate hearing how long it is. I want to like shorten it to one sentence, but one of the things I try to bring to my roles, different roles, but especially this project, is some of the personal experience that I have. And that's not just as a foster parent and now an adoptive parent, but also in my work in previous years with Big Brothers Big Sisters as a volunteer with the Y, and certainly in my experience with Little League. There's nothing really better to get a feel for the challenges and the successes and the strengths of a community, more than seeing it firsthand and kind of walking alongside some of the people and the kids and the families that we have the pleasure of either working with, volunteering with, or serving. So that's just a little personal note. And as we go, certainly you'll have an opportunity to hear more about what the Bundle Project is, where it started, and where we're headed with it. So I'm going to go ahead and share my screen and make sure that the sound is on for later. So as you can see here, we are really focused on helping support parents and their children. So we realize that it's not a one piece of the puzzle. We're trying to look a little holistically at the fact that a strong relationship with a either provider, or a strong relationship between the family and the community, and a strong health for the family means health for the baby and health for the provider, the caregiver, the parent. So as we go here, that is something I want you to keep in mind, is that Bundle, though it's really designed around children and babies, it's designed really in mind of the whole family unit. So not starting with data intentionally, starting with a couple of real world stories. So when we were going through this process before Bundle was even a thing, we listened to people on the ground, and this is in Piscataquis County where this was originated. And we wanted to know what was going on, what was happening on the ground, more than just what the data was portraying. And so these are real stories and real quotes from people. So think about a mom who's going to her local grocery store, waiting in line to check out, and then the cashier loudly tells the people behind her, this is going to be slow, I'm sorry. They have to use their state benefits. That's something that not only impacts that moment in time, but also whether that be the person in the back of the line who maybe needs WIC or is about to become pregnant and now is like, oh, I don't know if I want to do that. That's people are kind of pointing me out. They're calling me out. That was something that was an overwhelming theme throughout this process, was hearing from people and knowing that the people around them had a negative feel for people who needed help, a community that maybe doesn't quite support or understand the needs of their neighbors. And then another story we heard from somebody who went into the the town office to ask for some public assistance. So the general assistance director, instead of being empathetic and understanding, told this person, why don't you just go get a job? And we all know, I think, in this room, that is obviously not the right approach, but it also is a little simplistic to think that that wasn't something that they already were trying to do. There may be factors involved that maybe at this hard time that they are at a low point, that that's not the reality of they're just not wanting to get a job. So as we think about that, that really framed how we wanted to tackle this work. So we knew that on the ground, shame and stigma was a large portion of the puzzle. And then when you factor in at the time, and again, this is not current data, this is at the time where this was being built and created, this was the reality in Piscataquis County. We had numbers that painted a picture that show real challenges for families, real challenges for individuals, even if you didn't have kids. And when you look at the developmental screenings, when you look at teen births, ACEs, adverse childhood experiences, you're talking about immunizations and screenings, you're not at the top of the pack in Maine. And you have some real challenges with your rural nature that are impacting families. And so that's sort of where this started. It started with a combination of a real challenge, a real concern in one of the counties we serve. So here at Heart of Maine United Way, we have those 6 counties that are in that darker orange. We saw a challenge and we knew we didn't have a silver bullet. We knew we wouldn't be able to solve all of the problems, but we had to do something. And so that's what started our conversation with some funders. So we had initial support from the Maine Community Foundation and the Bingham program with financial support and partnership to be able to start to think a little bigger about what's going on in this community, what's going on within the world of early childhood, of parenting, of having a family and a new family in a community that is fairly rural. What is it that we can do to make some inroads? What are some changes? What are some waves we can bring to this? And so in addition to that, we said, United Way, we can do a lot of things, but we are not the end all be all for everything. We need people from different backgrounds, from different perspectives to do this. And so Helping Hands with Heart was actually a co-sponsor and lead on this project with those funders to say, we know we're on the ground here in Piscataquis County in the Maine Highlands, and we know that we can do more. We know that there's something to be done to help support moms and parents and caregivers and grandparents that can make a real difference. And so they helped, along with United Way, bring a diverse set of people to the table that involved healthcare, that involved public health nursing, state government. We talked to for-profits and people on the ground who were hiring people in that community. And we brought together a work group that really created Bundle from scratch. So when I say Bundle didn't exist, it didn't exist. Some pieces of those models exist in other countries and other parts of the US, but the actual brand of Bundle, the concepts and the details that you'll hear about today were really brought about because these people that served on this work group came to the table with fresh ideas, with passion, and with a desire to help make a better community for the Highlands. And while doing so, also knew that we had a bigger potential. So it wasn't just that we could make an inroads and make a difference in Piscataquis County, but we could create a model, we could create a brand that could be scalable and replicable in other communities. And at first, certainly rural communities would be a natural fit for it because that's where it was born out of. But as we think about that, the concept and the supports that Bundle hopes to provide can really be brought to an urban setting as well, but at the moment, really a rural focus. So this isn't all of the partners that were at the table, but this is a sampling of the partnerships that were critical. So partnerships throughout this process have been really critical to the creation of this. So as I mentioned at the time, we were the early childhood work group for Piscataquis County or for the Maine Highlands, which doesn't quite have the same flow as Bundle. So we knew we needed a brand, we knew we needed a name, and we were really thrilled to land on this with the color scheme, with the visuals, with the text. It can be something that is overlooked, but the brand and the way that something looks and feels can actually make a huge impact on how it's received. So we were really focused early on the concept that to be trusted in this community, to be understood in this community, we need to create something that's fun and approachable, something that's using plain language, and something that resonates with people. And so we took a lot of time to make sure we got the brand right, the colors right, and all of that. And it paid off in the long run because it's something that we are really proud of. It's something that parents really enjoy getting, and it looks really professional and really approachable. So Bundle was born, so to speak, through this work group. And when we built it again, designed it to be scalable and replicable in the sense that it's not highly specific in a particular geographic area. It's not tied to some sort of terminology that only would make sense in a portion of our state. It's pretty universal in its naming convention. And so as we built this concept and as we built this brand, there became kind of two key components that were in parallel alongside. One of them is resources. So we have really trying to meet parents where they're at. So trying to provide local resources that tie to local people that they will trust and do it in an approachable and easy to understand way. So when you see things on this screen, like I need help with drugs or alcohol, we intentionally were using language that people are familiar and comfortable with. Not using clinical terms, not using really robust language. We're trying to make it as plain language as possible to make sure it's accessible, but also that it looks friendly and inviting. So it might be something you're really nervous about as a parent. You might not feel comfortable yet talking to a provider or somebody about, but you're just exploring. And this is designed to get you some information at your fingertips that's trustworthy. It's somewhat, in some cases, it's developmentally appropriate things. So we're trying to point people in the direction of good, high quality information. And it also uses commonly used and appropriate resources in the state. So when we think about the network, certainly 211 and Help Me Grow, those are things that we need to be tying into as a brand that's currently a Maine-based brand that are existing, that have supports. We don't need to reinvent the wheel. We need to supplement and bring that content to people in a really easy to use format. So that's one piece, is that we created a website, and as you can see, it's mobile friendly. It's designed to be really accessible and easy to use, and that's at bundlemaine.org. And that Bundle Maine website is something that will continue to evolve. And so as we look at more territories, we'll have it branching. So it'll be specific to your geographic region. Currently, it is designed for Piscataquis County and the Maine Highlands, but it will grow and evolve to meet the needs as the project grows. So that became an important piece, having a directory and a repository and a really easy to use website. The other piece that really is a little bit more visual appeal and a little bit more fun for the parents is the bundled boxes. And so the bundled boxes came out of the idea of, we want to be able to provide people with some things, and we want to do it in a really fun and special way. So we combine sort of the pieces that we really liked from the Raising Readers program and the pieces we really liked from really for-profit publicly available subscription boxes, things that you can buy to give to yourself, or you can give to others as a gift that you probably are familiar with online, and take it in-house, build something that we can afford, but also that is high quality, looks really professional, and is exciting for a parent to receive. And so the bundle boxes became a way for us to provide to families some highly good quality books, some developmentally appropriate toys. We do want to provide them with some resources on parenting and on development, but we also don't want to overwhelm them with a notebook full of 100 things and they're overwhelmed and not going to read any of them. So we're trying to curate a box that contains a mix of things that are really usable for the baby, some information for the parents, and also provides high quality and fun things that they can look forward to. So each box, as you can see, as the baby gets older, have some things that are a little bit different, both with sensory, with tactile, with fine motor skills. As they get older, they keep getting new things in each of their boxes. And this was designed with the provider in mind. So they receive currently in Piscataquis County, they receive their first box typically at birth. So as the baby is born, they're getting their first bundle box. They will have received a welcome kind of packet or note beforehand, so they kind of know what to expect, what this is all about. And then they get that first box, and then at their well child visits throughout that first year, they continue to receive boxes 2, 3, and 4. So each of those boxes is an opportunity for the caregiver and the provider to be able to connect and talk and hopefully help build a relationship. So as we think about our goals for the project, in addition to giving the parent high quality resources and information, we also are hoping this is a tool for doctors and providers to build a relationship with fun things that encourages parents to make sure they come to their visit, to make sure they're not missing regular check-ins, and also hopefully boosting things like immunizations, developmental screenings, things that are important as not only that first year, but as they move beyond. And the reason we did this as a 1 year kind of punch is really from some conversations and best practices we had with the for-profit sector. So when we talked about marketing, we talked to some organizations. Banking came up a lot. And in banking, people tend to be comfortable with the bank that they've always used. So they had an account when they were maybe a kid or a high schooler, and there's really no major, often incentive or desire to just switch banks all of a sudden unless something happens. And typically, what something happens is a major life event. So you have something like a purchase of a house, a car, a loan, things that are typically a larger life event. And that's where you'll see a lot of the focus for banks is around when those life events happen, they're trying to, or opening a business, things like that. That's when you might be soliciting or looking for a new banking partner. And so that's where a lot of their marketing dollars go. So similarly, if we have people in the Maine Highlands who are feeling, if you recall from the very first slide, feeling like there's shame and stigma associated with getting help, if they don't feel like they're connected to their community, or that they might be, if they have questions or don't feel really confident about being a parent, that they might be not, as good as somebody else, feeling inferior, this is a time where we maybe can make an inroads and change. So that's really, obviously, if we had unlimited resources and dollars, we would continue the bundle boxes and do as many as we could until they were 18 or something. But in reality, we had certain resources available. And instead of it being like one box every year, we said, okay, we can do this 4 times throughout that first year. But we hope by doing it that way, they're reminded repeatedly throughout that first year that this is happening. They're reminded and get in a pattern of going to see their doctor with their baby. Hopefully, as the parent, they're going for their regular physicals and connecting with their own doctor regularly. And hopefully this also shifts the mindset that when my baby turns 4 and we maybe are looking at speech therapy, or they're 12 and they might need some mental health supports or whatever it might be down the road, that this stays in the back of their mind as this isn't a bad thing. It's okay to ask for help. So that is sort of some of the philosophy around why we put what we did in each box and why that first year is packed with those 4 particular things. So now I'm going to show you just a quick video that talks a little bit about what we just shared, talks about the program, gives you some visual aid, but also reinforces the partnerships and why it's been so important to have connections in the community to be able to implement this.
I would describe the bundle boxes as being boxes of joy and letting folks know that they matter in our community.
When you open up the box, you'll go, wow, look at that. What a lovely book. What a pretty toy. Oh, and there's something in here for me too.
The bundle program is designed for all families in Piscataquis County and the Maine Highlands area.
It's not something you have to sign up for or agree to or put your hand up for. Every family in the Maine Highlands region will receive 4 bundle boxes during their child's first year of life at their well child visits.
You know, this is a box that's going to be made specifically for
Crazy.
that
I just said to
infant
Scotty, his son's
family
gonna get home at
the
5:30, and I
developmental
said,
point in time.
sounds like your
The
son's
bundle
gonna be rolling in.
website is very comprehensive, and it is almost like a one-stop shopping app for any of the resources that are available in our region around Piscataquis County. For example, if they need help finding housing in the area, they could click on that box and it would give a list of resources. If they have needs for food, they could find out where are all the food cupboards.
Today, bundle boxes were packed here in this gym. We brought high school volunteers in. They were not only helping us with the bundle project, but they were seeing why it's so important to support their community and why there's organizations like United Way and Helping Hands with Heart. Bundle has been built around the idea of creating an inroads to families to be able to support and provide impact for them and give them access to services while also making it fun and accessible.
And that will encourage parents to bring their baby into their well child visits, which also encourages the babies to be up to date on their immunizations. So we're hopeful that this will be an incentive for them to come to their visits to get the appropriate care.
So at United Way, one of our core goals is around early childhood development. We think that it's a time in life when you actually have an opportunity to create change.
We're hoping that this is going to be a pilot project for the state, and my ultimate goal would be to roll it out throughout the whole state of Maine, and we would be the one in the country, and other states might take over what we've started.
Awesome. So I hope you got a sense from that we really leaned into the partnerships and being able to work with organizations like Helping Hands with Heart, like Northern Light Health, to be able to make this happen. But it also took a lot of partners to create something that was really accessible and exciting for families to have and to be able to lean on. So as we built this, we really had a goal of creating access to early childhood services, things like prevention, things that families may need, and at the same time reducing the shame and stigma that came with accessing and utilizing the services that may be available. So there can certainly in Maine, both from our rural nature, from transportation challenges, from just availability, be challenges with getting services, and we know that there's wait lists and things like that. But what shouldn't be a barrier is a willingness to say I need help, or a willingness to try to find what is best for you as the parent or for your child. And so that is where we really focused in on our goals. And so as we move forward and as we think about Bundle as a program and a project, we really want to think about having families thrive. We want to change some of those demographics, certainly, but even beyond just the demographics, we want to make sure that whatever that family structure looks like, and we know in the Highlands that family structures can be very different. There's a lot of grand families in that county. There's a lot of foster families, and there's a lot of regular, traditional families and single moms and single dads. And we need to be able to find a way to connect with all of those people. And one of the things I didn't mention when I was talking about each of the 4 boxes is the fact that every baby gets it. Certainly, if they don't want to, they can say no, thank you. But we don't have them sign up. We don't have a enrollment form. We don't require that they have a certain income. The idea behind this is that it's normal. Parents and caregivers in that community are going to receive this. They're going to receive the toys and the books, and everyone does. So you don't have to feel like I'm singled out or I'm in a certain bucket, which is why I'm getting it. And that's a really important part of our model, is by reducing the shame and stigma. It's by universalizing this, and hopefully down the road, universalizing things like home visitors and making, as you have a baby, having supports around you and having answers to things that are going on. So that's really our long-term vision, is that people feel connected and have a sense of community. And that is something that, beyond just having toys and books, having a sense of community is super important anywhere, whether that be for a teenager or for a new parent. Having and feeling like you're part of your community and you have a supportive network is really critical. And that's something that I think we're proud of as we think about how this project has rolled out. So when we think about why we targeted Piscataquis County and why as we have expanded this program, which I'll talk about, why we've really landed as our first priority on some more rural communities and counties. So we know that, as I was just talking about with a sense of community, isolation can be a real thing. Certainly stigma and shame can really feel that way when you're in a closed, tight-knit region that everybody knows everybody. And if you sign up for something or apply for something, everyone might be talking about it. That's a real challenge that we have to overcome. And also, it's complex sometimes to enroll in things. And we'll talk about eligibility as well, but just to have access to being able to sign up for any programs or services, even if you're willing to do it, sometimes is complex, and trying to break down some of those barriers. And as of course we all know, caregiver stress certainly impacts child development. So if we have a program or a model that just focuses on the baby, we're missing out on a piece of the puzzle that's really important, and that's the health and support of the caregiver. I honestly can't believe I didn't mention it, but when we were talking about the contents of the boxes, one of the things that goes in there as well is a gift to the caregiver. It's a token gift, but it's something that's a reminder to them that, parenting's a little bit difficult. It's okay to take time for yourself. It's okay to feel overwhelmed. It's okay to not have all the answers. And that message in there is a little bit playful, like something like parenting is hard, but coffee helps, and then a $5 gift card to Dunkin' Donuts or something like that. It's really just a reminder that things are supposed to be challenging. It's not unique. It doesn't matter what your demographic or background is. It's a time where there's not always simple answers, and that's okay. And that reminder to do self-care is an important part, and is not something that you see in a lot of programs, typically because it's hard to fund. Typically, it's hard to fund something like a gift for a parent, or something that's not directly tied to the support of the family unit or the baby. This is just something that we thought as a group, as a work group, was critically important to remind families to take time for themselves. So when we talk about eligibility for services that already exist, one of the challenges is that we currently use a federal poverty guideline that is really not an accurate representation of what poverty really is in our communities. And so at United Way, we've leaned into the ALICE model, which stands for Asset Limited, Income Constrained, Employed. So think of that as people who are often working in multiple jobs, but still aren't making enough money to afford their basics. So it's a math equation, and you compare a household's income to the household's expected expenses. And that obviously varies based off of the household makeup. If you're talking about, an adult who lives alone versus a a person who has 2 kids or a family of 4 kids. It really has a different, of course, cost, and then there's income associated with that. So Alice is a model that really looks at a true measure of financial hardship. So what you're seeing in this pie chart is a graph that shows in Maine, according to the federal poverty line in 2022, 12% of Mainers are in poverty. However, when you think about the real cost of living versus income, that Alice number is 30%. So all told, we're talking in Maine about 42% of our communities, of our neighbors, are really struggling to make ends meet. They're struggling to afford their basic needs. Basic needs, things like transportation, housing, utilities, medical bills. And that's something that's really, really important to factor in and think about when you're talking about how work in our social service sector is really targeting and using eligibility that's not a real measure of how our neighbors are struggling. I could do an entire presentation on Alice, so I will talk a little bit more about it, but Alice is a really important piece as we think about evaluating our work. And so ignore the graph on the right for a second, but these are the counties that we're currently using for bundle. So we talked about Piscataquis County, but we're also looking at Hancock, Waldo, and Washington County as we think about the rollout and expansion of our bundle project. And you can see that when you add up these 2 columns here of the percent in poverty and the percent that are Alice, we're talking that every one of these counties has a higher than the state average number of people, including all the way up to half of the households in Washington County are not able or struggling to afford their household budget. It's a really staggering number, and as someone who's lived this Alice data for quite a while, it's kind of sunk in now. But when I first saw this report and first started digging into the data, it really took me a while for my head to wrap around just what I was looking at and just how many of our neighbors here in Maine are struggling. But I encourage you to look at that, and the website is on the top, AllisonMaine.org. I encourage you to go there because there's a lot of ways that you can look at the data. And there's a lot of ways to start to think about and kind of refine and look at different filters to dig in a little bit deeper. So the heat map here is showing you single female-led households with children. So you're talking about kids living in households with moms. Look at how high these numbers jump when you start taking away from the general population, this is all households, and start looking at single female-led households. It is a remarkable number of households that have those in poverty and those who are Alice leading them. And so when we start to look at that data, we need to think, how can we make sure that those families, those households, are getting the supports, they're getting the sense of community when they may feel the financial stress, when they may feel like they're never able to make ends meet or ever able to get ahead or have a savings account, or worried about what happens when my kid goes to walk-in care or is sick, or I have to stay out of work and I'm an hourly employee. All these many, many things that are factors that go through a household and a family's and a mom's head, and not feeling that sense of community and support behind them is just something that we really can't afford. So we have to find ways of building senses of community in how many ever ways we can. So if we have time, I'm going to take you over to look at a couple more data points on the Alice website, but I'll leave that for now. But know that Alice plays a significant role in the way that we think about our program implementation and how we expand the bundle project. So as we've kind of highlighted and mentioned, we designed bundle in a way that was not a singular kind of focused, we are going to do it at United Way and we're going to just do it our way. We knew we needed people who were parents. We needed people who were living and walking the walk, people who were going into homes and helping newborns, doctors and healthcare providers, and community members who are part of those communities. It's not a one-size-fits-all model. Even as we've expanded into other counties, we need and have got input and the local flavor of here are things that are maybe different in our community. Here's what matters to us. And in Maine, we know that that local flavor is so important, and that model of bundle is not so rigid and strict that it can't have pieces that are different community to community. And that is a really critical part of this. So the great part is we've created this model. We've created a model that's replicable and scalable and remains in ways flexible to meet the needs of a community that it expands to. So right now, focusing on rural communities, there's overlaps and similarities, but there are nuances and things that have to be tweaked and changed. And you also want the buy-in. You want people to be supportive and proud of the bundle project and wanting to champion it in their community and in their work. So that's sort of where we are as far as how we designed it, why we designed it, and as we move forward, why we're always looking at keeping it local and keeping the people making the decisions and helping us move this baton forward really in depth and in the loop and critically important to the model. So we have to come back to a quote. So we talked about some really sad quotes at the start, but I want to fast forward. When we have events in the community now, we've been live doing boxes in Piscataquis County for over a year now, coming up on 2 years. And this is just sort of exciting when we have parents coming up to us at a community event and they are proud to say, we have bundle babies. So they see our bundle sign and they come up and they literally say, we have bundle babies. And similarly, a parent came in a stroller to another event and just was, I didn't know what she was doing, but she was fishing through her backpack and then she starts pulling out bundle toys, things that came from the bundle box. And the idea of that is, okay, it's a toy. Yes, it's awesome. The kid likes it. It's something fun for the parent to get. But it reminded me of what we did to begin this, why we started this, which was to create that sense of community. They're excited about it, but they also feel like people care. They feel like there's people out there who want to support them, who want to help them. And they also feel like they're part of a community that supports one another, that has a safety net. And don't get me wrong, I'm very passionate about this. I'm very proud of this. I say that in a very positive way. I'm still not coming to you and saying this is a silver bullet. This is a perfect solution. This is going to solve all the problems. This is just one slice. This is something that does create inroads, does have a lot of potential, but it is not the silver bullet perfect solution. But it is something that we are really proud of because of things like this, the community, the ability to have supports for families. And so when we think about data and how we're really digging into this, we have a large pool of different things that we're looking at, but things like increasing the awareness and support of local resources, making sure shame and stigma is decreased in making sure people are utilizing services, the relationship between providers, healthcare providers and their clients and patients is really important. And then as we think about those moving forward, while they're getting bundle boxes and even after they get their bundle boxes, how is that increasing participation in those visits? So we're decreasing no-shows and cancellations for those appointments. And again, as I mentioned earlier, this is not something that is a 1-year piece. The boxes currently are 1 year, but we're hoping this changes some habits and behaviors as it moves forward. So thinking about how we are looking at this, we do really have a delicate balance. So our goal of this project is to reduce shame and stigma, to increase utilization of services. So we don't want to create a feel that, okay, we're going to send out a survey and we're going to hope that, people tell us just, how, they're struggling financially so poorly, they have so much strain and stress. Like, the goal of this is not to make people tell us that, oh yes, I have so much stress in my life and this is so great. Like, that obviously would be great for a grant. Maybe it would be good for data sourcing to put on our website as an infographic, but it defeats the purpose of what we're trying to do. We're not trying to make people reflect on how stressed they are or how in financial hardship they are. So we're really balancing collecting data in ways that gets us good information and allows us to show how this is impacting families and how this is moving the project forward, how it's impacting their behaviors and how they feel about having a baby and in their community, but also not making it onerous on them. So we're really doing a lot of work behind the scenes to get a lot of really good data, use that data, but have it be in some ways either optional or have it be not quite as easy to design as it might be for a program that doesn't have that as a key goal. We also want to know from the healthcare providers, how is this impacting relationships? How is this impacting your work? Is this benefiting you as a home visitor? Is this helping benefit you as a doctor in a pediatric office? And then certainly, as I mentioned, the optional participant survey. So that's getting the feedback directly from the parents. So that is a brief snapshot about how we're kind of looking at data and our philosophy on data. And as I mentioned, we've piloted this in Piscataquis County. So this was built and born in the Highlands. We are now expanding it to Waldo, Washington, and Hancock County this year, which we're really proud of. So that's been because of support from people who have seen the effectiveness of the program, who have bought in, who know that this can create real change in communities. And so as we think about those opportunities to expand, we would love to be everywhere. We would love this to be like the Raising Readers program in every community and every town. But as we think about that, we're taking a very practical road to expansion. We want to make sure as we expand that we have the resources to do it in a thoughtful way, that we have the ability to serve families in a really effective way. So as we brought that pilot to other communities, it's building the work groups, getting the local flavor, getting understanding of that cultural components, things that are unique to that community that we need to be aware of. And as we do that, we've been very thankful to have support from a CDS request. So Senator King and Senator Collins supported a CDS request a couple of years ago to help with the continuation and expansion of this. And then more recently, we also received support through the state and through the preschool development grant to be able to bring this to more places. And so as we grow, we want to make sure we're doing it in that thoughtful way, but we also want to make sure that people are aware of the value of this and that they understand how they can play a role. So as you think about how you could play a role, here are some ways that we think that you could get involved or that people that you might know in your circles. So as again, I mentioned, work group members are really important. So we think about the counties that I just shared, Hancock, Washington, Waldo. Piscataquis has obviously a really solid group, but if you are in that community or if you have passion, we would always welcome that. But as we think about the newer groups, those first 3 counties are ones where we're really actively recruiting members to help serve on our work group. Partnerships and sponsorships. So I talked at the start and along the way about how partnerships have been super valuable. So as this grew, we've had organizations come to us and want to be part of it. So sometimes that's a for-profit, like Bangor Savings Bank and the Bowie Local Program sponsored in the Highlands the Fourth Box. So the Fourth Box had a larger gift to the parent, and that gift was from Bowie Local and Bangor Savings Bank, which is super generous and super thoughtful. That type of gift or in-kind partnership is really awesome. We've also had others that are like in the nonprofit sector. So the Alfond grant, the babies in Maine get $500. It's an awesome program. They want to get the word out. They were able to put some information and sponsor a box and be able to make sure people were aware in Piscataquis County that that is something that your baby gets, and all babies get it in Maine. And so those are opportunities where it's a win-win. We are, we have a model and a method that we're focused on with Bundle. But if there's an organization out there that is in this world of early childhood that supports families, that's a good tie, like the Alphon Foundation, it just makes a lot of sense. Get that information into people's hands so that they know higher education could be something, or trade schools or whatever it may be, that could be really beneficial for them to start thinking about, even if they just have a newborn. We're always looking, as any nonprofit is, for continuation of funding. So we're always looking to recruit more dollars to bring in to support this project and to help serve our existing families, continue the project in their existing counties, and then hopefully again expand. And then just really an important one is also advocacy and support. So just having a positive outlook on why Bundle exists, what it is, being able to not necessarily champion it, but promote it when possible, and be aware of it and share it with the right stakeholders. That is something that really, I think, brings value to our work, and hopefully is a positive alignment with your own work. So as we get close to the Q&A here, I just want to certainly thank you all for learning a little bit more about Bundle, for understanding sort of where we are at, where we're headed. We have a lot of great plans for Bundle in 2025, but also beyond. If you saw something on that ways to get involved list that you're excited about, or want to connect more, or have a question that doesn't get answered today, that email address at the bottom, bundle@homeunitedway.org, is a great way to get in touch with us about this project. And then, of course, my own information can be shared as well. But with that in mind, I do want to make sure I save time for any Q&A that there is, and I will go ahead and pull my screen share down.
All right, it looks like we have a couple questions so far. So someone asked, if there's no enrollment or sign-up process, how do you find the pregnant moms to send the bundle box to?
Yeah, so currently, the vast majority, like I'd say 95% of the people who receive bundle boxes are getting them through their primary care provider, or through where they have where they birth their child. So it's something where we are providing and having a relationship with the healthcare providers. So we aren't getting, obviously patient data. We're not getting any names. It's something that is conducted between the healthcare provider and the parent directly. And then they are continuing that at their well child visits through their primary care practices. We do have some that are also have home visitors. So things like Maine Families or public health nursing, that as they, perhaps are not going to a healthcare provider in the county that they live in, they might be going somewhere else. They're also getting those boxes as they have those home visits. So that's a much smaller percentage, but the vast majority, because there's no enrollment, because we want it to be as universal as possible, are getting it as they go to their healthcare providers as they are in those counties.
Awesome, thank you. Another question is asking if you're coordinating with the Imagination Library.
Yeah, so we have a lot of great contacts with the Dolly Parton Imagination Library, both as it's a United Way kind of sponsored or supported at a national level program. And then locally, there's a lot of different organizations that are leading the charge in different geographic regions of the state. And we've had really great conversations with them. They are, their model is certainly to deliver those books to houses. And often, as we think about the age demographics, we are a sliver. We're 0 to 1, and the Dolly Parton goes much beyond that as they get older. So we think they're very complementary. And certainly we were disappointed, again, that the Raising Readers program was kind of sunset, but in hopes that between Dolly Parton and our kind of bundled books that are currently only in certain counties, that there's some great reading material for families to start connecting with their babies with, and as they get older, of course, reading on their own.
Another question is asking if the bundle box is for pregnant single moms that have a family, or pregnant moms that are married and have big families, etc.
Could you say that one more time? Sorry.
I think it's just asking who the bundle boxes are for, if it's just targeting pregnant single moms, or
I gotcha.
parents that are married.
No, it's for every family in that county. So that's the goal. Obviously, we're not perfect and we sometimes miss a family here or there, or it's forgotten at a particular well child visit. But the concept is that it's for every family that is having a baby in a particular county. And within that, that ranges from a spectrum of those that are married, single, certainly, if a baby is born in a county and they are now in a foster situation and they are in the custody of a foster parent, those foster families would be getting the boxes. So it really is designed, or a grandparent is taking the baby to a visit. It's designed to be whoever that caregiver is and the baby, not any one particular family structure or type.
Then we have a follow-up to the pregnant people question, asking if a bundle box, oh, it just disappeared. If it could be developed for pregnant people that folks could get from their OB/GYN or midwife.
Yeah, it's something that's actually come up more recently, certainly as we've been rolling it out in new counties, different concepts and kind of common things have popped up. And one of the questions is around the midwife. And that's something that we haven't flushed out as far as a determined model, but I think we would certainly be open to how does it adapt to different ways that certain communities are often having their babies. So from a practical perspective, sometimes there's a little bit of the weeds as far as how many babies are being served in certain ways, and we want to help and serve as many as we can. So we're open to those kind of different ways of doing it. But we also know that currently our kind of biggest bang for our buck, the way that it's the way that we can most effectively get the most boxes into the most hands is through primary care practices and birthing hospitals and directly through that, but still keeping certainly the door open to how do we effectively hit the people who are not going that route. And we don't have all the answers to that yet either.
Awesome, thank you. I'm not seeing any more questions right now, but if anyone has any more questions for Matt, feel free to.
Yeah, and what I will do quickly while there are no questions is I just will pop this up and I won't dig into it, but I do want to show you just very briefly. This is what if I go to the top of the page, this is what the Allison, Maine website looks like. And within that, there's all kinds of content, but I'm going to just point out two of them. One is the maps feature. So the maps feature is where you can look at all kinds of different types of filters. And so when I was showing you earlier with the single female-led households was that exact map where you can see the data that was on that slide. But you can also look at different types of things like age, or you can look at married. And so when you talk about married with children, you jump to a significantly different picture. So you have the percent below the Alice threshold at 24%. This is just a really cool, and I mean, cool is not the right word, but I think it's a cool way of looking at some of the data and digging into a lot of different pieces of demographics. And then the only other thing I'll point out here, and then I'll get back, I think I see some things popping in, is there's also different things like Alice in Focus. So this is like a specific topic area under children. And within that, you can look at the state of Maine. So this is all families in Maine. So all the different households that have children. So you can see that in Maine, 56% are above the Alice threshold. But again, you can use some different tools. So this one I think is an interesting one. If you look at renter households, you can see that renter households, you can see that jumps to 45% who are Alice, 32% who are in poverty, and 23% that are above the threshold. So again, using some of the data points that are available, you can start to see where some of the pain points are within the financial security angle, and we know that financial security has many ripple effects and impacts on parenting. So again, just a couple of quick little snippets, but I would encourage people to look at some of that data. And again, I mentioned I could do hours on Alice, so I won't, but it's a really interesting tool.
Yeah, thank you. I think we have one more question asking if you're collaborating with United Way in Franklin County to provide bundle boxes there.
Yeah, so we've been working alongside, we have a really great relationship with all the United Ways across Maine. And we've, at our all staff training that we recently had, we were bringing bundle and presenting on it to make sure everyone was really aware of what we're trying to accomplish and how we could potentially bring that into their communities. And there's some interest and appetite. And similarly, when we talked, you know, when I mentioned the grant from the preschool development grant, there are some target counties and communities that we would like to expand to that are not in our 6 counties, and we are more than happy to partner and do that as it becomes appropriate. At the moment, we're really focused on the counties that we have identified, because we know that each time we expand it, we're refining and getting better and documenting better how to replicate this in other places. And so our goal from that is to have a really smooth transition and step-by-step implementation on how you take this model and bring it to a community, including those communities that we don't, quote unquote, have, you know, control over or purview over as a United Way. But it will, you know, certainly my vision is it will be in other parts of Maine beyond our 6 counties in this decade.
Awesome, thank you. Super exciting.
Yes, and thank you so much for inviting me on to speak, and everyone for taking the time to listen about what we're trying to do with Bundle.
Yeah, that's great. Thank you so much. And just as a reminder, Ryan put the evaluation link in the chat if people don't mind filling that out. But thank you again, Matt. We really appreciate you being here.
I'm happy to do it. Thank you so much.
Thank you, Matt. Thank you, Hannah. Have a great afternoon, everybody. Enjoy the sun. Take care.
Bye, everyone.